Ozoude. I'm an orthopedic surgeon in Houston, Texas. I specialize in sports medicine, so that's athletic-related injuries. When I was 16 is when I really decided that I wanted to be a physician. Before that, I actually loved sports so much that I wanted to play basketball for the rest of my life. When I realized that probably wasn't going to be either the long-term plan or the realistic plan, then I started thinking about other things and other ways I can still be around sports. The majority of my family members are in medicine. My father's a doctor, my mother's a nurse, and older related family members who are in medicine, interventional radiologists. And so I think it had that influence on me. And that's around the time when I decided, when I was about 16, I was like a sophomore, junior, is when I decided to find a career within sports and medicine. So that's when I decided to go into medical school. I remember an English teacher of mine in the 10th grade took us to the library and had us look up different careers. And we started looking through all the different library books and the career sections. And I found that, sports medicine is an actual field. I didn't know exactly what it meant, but I knew it combined two of the things that I had an interest in. Come to find out, orthopedics is just one type of sports medicine. And there's many different types as well, even within medical school. But even outside of medical school, there's physical therapy, there's kinesiology, there's sports science, there's sports psychology, there's sports management. So there's a lot of different ways to have a career in sports medicine. And then orthopedics for me became specific and became the target in my first year in medical school. I really didn't know about the differences between, say, orthopedic surgery or family medicine or internal medicine. And there's even an emergency medicine branch of sports medicine. So I had to decide at that point which type of sports medicine I wanted to do as a doctor. And when I looked into it, I figured that sports medicine orthopedic surgery is the field where I get to use my hands the most. It's the field where I'm kind of the last line of defense. And I really work within a team, whether it's in the clinic or in the operating room. And so that one had the most attraction to me as far as which type. And then from that point on, I was pretty much locked in. I kind of considered some other things, but very late in medical school, I thought, wow, radiology was a little cool. But honestly, it was always going to be sports medicine, orthopedic surgery. In college, I was a physics and biology major. I think that is kind of the typical route for going into medical school. A lot of students traditionally will do some kind of science-based major, usually bio, chem, physics. It's not a necessary thing. In fact, right around the time where I was leaving medical school and residency, I noticed there was a emphasis on non-science related majors, because all you really need is the prerequisites. There's certain science prerequisites classes and math prerequisite classes. And if you get those taken care of, you can still do whatever major or minor you want. And in fact, those other majors, they actually help you be more well-rounded, which is what we need to be as physicians. We're going to get the science no matter what, whether it's in undergrad or it's in medical school. We're going to get the science for sure. What we don't get is the business or the economics or the public health or things like that, or the law, the legal side. So I would encourage, even though that I did bio and physics, the typical science, I would encourage any student to do whatever major they are interested in. It's actually going to help them not only with being a good doctor, but actually helps you get into medical schools. Admission directors are looking for that. I started the physics in my third year because I was so interested in it. I started out as just a bio major. So, it was a good experience. And I think it definitely prepared me for the first year of medical school, which is heavily science-based. It's physiology, it's anatomy, it's biochemistry. So it absolutely helps kind of getting you ready for that level of discipline studying. And then the medical school experience was really interesting. It's the first time, I really, really had to apply myself, and everyone's different, but I really had to apply myself as far as timing and how much I spent reading, because it's mostly a game of volume. It's how much information you have to absorb and be able to, communicate that it based on a multiple choice test usually. So that's really the game in medical school. It's how disciplined you can be. And it really, also depends on your study style, your learning style. And it was actually a good experience for me in medical school. I felt like I got down my routine early and I got it down pretty good. So I would recommend that to be a strategy, is to really focus on getting down your routine. It seems like the business side of medicine is not really relayed at any point in the training, or I don't want to say at any point. You do get some exposure, but you learn the most of what you're going to understand about the business of medicine once you are out and practicing. It's impressive. It's impressive how much there is more to learn. It surprised me how challenging it can be to deliver good care. It's not just about the books. It's about, understanding systems and processes and how to deliver care. So I'm learning a lot right now in my first 10 years and how to adjust. I'm definitely making adjustments that I didn't think I would be making, once I finished all my training and started practicing. I thought it would be just practicing and, that would be it, just the medicine. But now I'm really learning about business, learning about economics, learning about how to deliver care, how to get through all the hurdles, whether it be insurance companies or hospital systems or patient, education, their awareness. There's a lot of different things you have to navigate around in order just to deliver the good care. So, but it's doable, and I'm very optimistic and happy learning about it. So I'm transitioning away from the inpatient side. So I do less of it now, and I do more of the outpatient side, which is, just so you guys are aware, it's both surgery and clinic. So outpatient can be outpatient clinics where I have an office, I see patients as they choose to walk in. Whereas outpatient surgery is, I still go to the operating room, but my patients go home the same day. So that's kind of what my practice is looking more and more like. And so on a clinic day, clinics usually start by 8:30. So I'm an early riser. I've become an early riser. And most doctors' clinics will start between 7:30 and 9. And so, yeah, I kind of get a lot done before that. I like to get up and fairly early, 4:30, 5 o'clock, get my workout and my kind of, I call it me time in. So if it's a meditation, if it's reading a book or podcast, I like to do that, answering some emails, obviously a good healthy breakfast, and then getting to work. So that's about 3 hours, 4 hours before I actually see a patient or converse with my medical staff. And so clinic can range from, just the morning clinic where we get out at about 12, 1 o'clock. Sometimes you can have a fuller clinic where you get out at 3 or 4. And then I'm usually home by then and kind of running all the errands, and usually to bed by 9 o'clock, 10 o'clock, to repeat and do it all over again. Whereas in the operating room on an operative day, it starts a little bit earlier because most surgeons like to start between 6:30 and 7:30. So I would still get up same time, just a little less time, less me time that day, because I get to the operating room in the hospital or the surgery center about 6:45, 7 a.m. Usually my OR days will be between 3 to 5 cases, and they vary in length. Some cases are 5 minutes, some cases are 4 hours. So it really depends. But on average, I would say cases I do usually all finish up by 2 or 3 o'clock in the afternoon. So slightly earlier day compared to my clinic day. Patients are from various different backgrounds, different walks of life. You have to be able to kind of be patient enough to kind of let them tell you what is wrong and what they want to tell you. That's very, very key. It's a skill that can be learned, can be practiced. You have to have the skill of thick skin. You're going to have ups and downs, and you just can't let it get to you when you have some downs, because you don't want it to affect you for the next patient. You want to still try to be 100% for the next patient, even though you have some challenges and obstacles. So you kind of have to be resilient. I think that's the better skill, I would say, or quality, I would say. To be a surgeon, you definitely want to practice your surgical skills. You want to be able to identify your learning style so you can always engage in lifelong learning. You never want to, kind of be stagnant in your learning, and not really advance with times, or not really, practice your craft. So I think that's very, very important. You want to be sociable, because the majority of the time you're working within a team setting, whether it's your staff or your colleagues, and you just will do more and do better the more people that are going with you. You can go far alone, but it's better when you go with other people. And so you want to be able to be cool, or a collaborative environment. I really enjoy when I can have this operative experience to help athletes get back to playing their sport. There's some challenging injuries for certain players and their families, and it's really remarkable when you kind of are there to help them when they're vulnerable. A lot of things are going on for them at that moment. And those are probably some of the most memorable times for me, is when you can kind of just step in, and then you can really make an impact right then and there on everyone's fear and their anxiety and their uncertainty. You can see that, and when they appreciate that, that's really impactful. You see how they calm down when you give them the information. You start explaining to them what's going on, and you educate them, and you bring their understanding to a point where they are a lot less nervous. They're a lot more confident and optimistic. This is such a powerful moment that happens when you take care of patients with acute injuries, whether it be sports or in the ER. When I used to take call, same thing. It is an amazing field. There are challenges, don't get me wrong, but I think there's really, really good solutions to those challenges, and you can still be a good doctor, the doctor that you always dreamed of. There's absolutely still a chance to be that kind of doctor. And in the end of the day, you're still serving. And I think that's what most people want to do. They want to serve, they want to be of help to other people. And there's just very few professions that can offer that in the way that being a physician does. So there's so much reward from it that's still out there. It's just a matter of figuring it out, learning from folks and doctors who've come before you to figure that out, and figure out how to get past those obstacles. And it's worth it. That's what I would say. Plenty of resources, growing number of resources with podcasts and different Facebook groups. There's tons of resources out there now. I would just encourage everyone to really embrace the journey that you will go on if you decide to go into medicine. It's an amazing journey. And like I said, the rewards are there. It's worth it. You'll live a very fulfilling life because you'll be serving others. You'll be doing good and doing well. I think a really good podcast that I've been listening to for the past year that kind of touches on healthcare issues in a really positive way is Healthcare Americana. I really enjoy that podcast. They put the patients first, and they take a look at the business side of medicine and all the other intangibles and things that we don't really know about, that kind of we need to understand in order to really deliver good care. That's a great podcast to listen to. Becker Health is also a good podcast, similar fashion. I think they're a little newer, but excellent resource. I just recently started listening to them. As far as books, I think a lot of mindset books are really good books to learn and read from, or learn from and read. So I think mindset books like Rich Dad, Poor Dad is a great one. It just kind of puts you in the mindset of kind of making sure you're in the right frame of mind to help others to really achieve a level of freedom. And that way you're not really bound by anyone else in order to do the things that you want to do as a doctor. And the author of that book is a friend of another author who wrote a similar book specifically dedicated towards doctors. And it's called Why Doctors Don't Get Rich, by a friend of mine. His name's Tom Burns. Great book. I recommend all future doctors and current doctors to read that book. I think the research behind orthobiologics is probably the most exciting thing that's happening in the field. AI also is very exciting to kind of figure out how to train, how to, get repetitions and practice, how to spread information. the information technology age is just huge. I think those two or three things, really open up a lot of possibilities for orthopedics and sports medicine. With orthobiologics, we're talking about different ways to use kind of the body's natural, healing processes in a very concentrated, focused way to kind of heal injured areas of the body. And it's even beyond orthopedics. It's being applied in other specialties as well. I think as the more we learn about that, I think there's a lot of good that can come from that. And then with AI and technology, we can teach each other better. We can learn better. We can practice better. We can be more efficient. And so I think that is really exciting to see what comes from that.